Today we're going to talk about some of those common concerns and resources for new patients. And we kind of just wanted to do this presentation just to give everyone who is here an overview of some of the support and resources that are available to you that may be most applicable to you following this new diagnosis, and can also kind of help provide some normalization that you're not alone going through this, and that your feelings and thoughts that you may be having or concerns are concerns a lot of our cancer patients have. So we're going to review some of those concerns specifically, as well as go into not a deep dive, but into a little bit of depth about some of those resources that are out there and applicable to patients up in the Chicagoland area. So one of the first things that patients tend to have questions about or request guidance on is, how do we break this news? How do we tell our friends, family, and workplace that we have cancer? Is that something we want to share? What is the best way to share this? Are there benefits of sharing, or is it better to keep this more private? Obviously, breaking the news is a very personal decision, and there's no right or wrong way to do it, but what we're going to go through are kind of some ideas on how to break the news if you choose to disclose, and just kind of some resources that could be helpful in choosing to disclose. So first step is, how do we break the news to our family and friends? And what you need to do first, though, is just give yourself some time to process your feelings first following a diagnosis. There's no right time or way to tell others of your diagnosis, but I think taking a pause and just allowing yourself to have the moments of sadness, of grief, of anxiety, of anger, of frustration, just let yourself process through some of those first. There shouldn't be any pressure for you to have to tell everyone right away. I think that's something that there's a lot of well-meaning family and friends that want to be helpful and know what's going on, but really you're the most important person in all of this. So you need to give yourself time to process your feelings following your diagnosis before you can even process how do you tell other people. One thing that might be really helpful to consider is who's going to be your positive support system, such as those immediate family members or friends. Who do you know is going to be 100% in your corner supporting you through this experience that you're about to go on? And not everyone is a positive support system. Sometimes friends and family don't know how to support you through this. So just really be mindful of, okay, who's going to be our positive folks that we know we're going to be able to rely on and call anytime to ask for help and support. And you might want to think about talking to them first, and they can sometimes maybe be a good buffer between you and other family and friends to kind of help ease some tension or make it so that's not falling on you to always be the one that has to talk about this. Also, you should think about, how much do you want to share? Do you want to share the extent of your disease? Do you want to share the type of treatment you're going to be on? It's really up to you to determine what makes you feel most comfortable. I've had patients that don't tell their families anything. I have patients that tell their families some things, but tell other family members more, those positive support people, as well as folks that just tell everybody everything. It really just depends on what's going to help you the most and what fits most with you, with your personality, with your way of doing. As I kind of mentioned earlier, it's always a great idea to try to establish someone who can be your point person and who can field questions or concerns on your behalf. So a lot of times what we find following a diagnosis is that you have a lot of folks reaching out, wanting to know what they can do, how can they help, wanting information and details. And although that can be lovely to know that you have a lot of folks on your side, it can also be very overwhelming at the same time, having to share your story over and over or talk about the cancer again and again. And it can also feel a little bit isolating and a little bit like that cancer is taking over. That's all anyone wants to talk about. And you're more than a cancer diagnosis. So sometimes establishing a point person that you can be like, hey, today's going to be, I'm having a rough day, you know, here's my phone, or I'm just not going to answer calls. Can I just let you know who to follow up with, and have them feel that, so you don't feel that pressure and burden on yourself to have to say the same things over and over, have to talk about this over and over, because that can be really traumatizing and depressing. Another great idea that a lot of patients utilize, it's not for everyone, but it can be wonderful, is establish a website such as a Caring Bridge that you can update on your own time, disclose as much as you like on there, and then you refer your family and friends to that website so they can get updates. So it kind of takes that pressure off of you of having to disclose 20 times over, you know, what the newest update is, versus just writing it out once, letting folks know you've updated this website, this Caring Bridge, and then you don't have to keep talking about it. Sometimes we just want to say our piece once and be done. Talking about it over and over can be really hard. So having someone either manage the website or be your point person, your buffer person, or you managing the website on your own is a really good way to keep people involved, keep people up to date, but not have to be the one to always be talking about this. Similarly, we could always get a lot of questions on how do we tell our teens and our children that we have cancer? And oftentimes that is sometimes more difficult to tell our children than it is for us to even process the diagnosis ourselves. So as a rule of thumb, it is important to tell your children that you have cancer and be honest as to what cancer is. Children are smart. They're smarter than we sometimes give them credit for, and they can often pick up on clues, or they can overhear conversations, or they can rummage through your papers and find out that something is going on and that something's not right within the family system. And not telling them can actually increase and lead to anxiety and fear. They know something's not right, they're hearing some things, but no one's telling them what is wrong. And that can be very anxiety provoking and can cause a lot of fear and unsettledness for our kiddos. In the same sense, though, it's okay to delay telling them until you have more information, such as what is our actual treatment plan going to be? Are we looking at chemotherapy, or are we looking at surgery, radiation, immunotherapy? Is this going to be a treatment where you're going to look physically different for the kids, or is it not? So sometimes it's okay to delay telling them until you have more information, but it is still key to tell them what is going on. Because children tend to understand best when they can see the whole picture versus bits and pieces. So sometimes when you're presenting to them that you have cancer and this is how we're going to treat it, and this is what we're expecting, and this is how we're going to stay strong as a family, and how we're going to work through this as a family, is a lot more settling for children than just hearing bits and pieces of things. One of the most popular questions that children tend to ask is cancer contagious, or did they do anything that could cause your cancer? So it's really important to provide reassurance that cancer isn't contagious, that they didn't do anything for the cancer to occur. Sometimes you may get questions about, are you going to die from cancer? And that's always a hard question to answer. And as just a rule of thumb, I always encourage our parents to say that's not in the plan for this to happen, and we're going to do everything that the doctor recommends or tells us to do to prevent that from happening. So you're providing, again, that reassurance, but also being truthful with them as well. And also, don't be super surprised if this conversation that you're having with your kids is one-sided. They may not have a lot of questions to ask. They may need some time to process things. So don't be surprised if after you tell them there's not much of a reaction or much of a many questions coming your way that may happen at a later date. So I think it's just important to share the news, give them that space to process, and answer what questions they do have coming up. And it's always okay to say, I don't know. You could always tell the kids, you know, I'm not sure about that answer, but let me talk to the doctor and find out if they're asking very specific things. That's an okay thing as well. So I listed here, and this will be in the PDF that Sue shares, are some great resources for further discussing and how do you break the news to your kids. I'm actually going to pull a few of them up here. I have them preloaded. So one of my absolute favorite books to use is Simple Talks for Tough Times, Talking with Children About Cancer. It's a free PDF publication that you can download and print off when you need it. What I really like about this book is, and I'm just calling through things, is it gives you ideas on how to break the news, how you prepare for yourself, what things to keep in mind, and then it breaks down in developmental ages, things, how to do this, things to consider. So there have suggestions for those that are, you know, infants to 2, 3 to 5, 6 to 9, 10 to 13, and then our teenagers 14 to 17. So it gives some really great age-appropriate tips, tools, and language to utilize when you're breaking the news about your cancer diagnosis to them. It also helps give some guidelines about facing uncertainties. You know, some of the questions that kids are inevitable to ask. And again, breaks down age-wise, what are some of the best ways to manage answering these questions. And then the other section I like a lot is that it gives some guidance for special circumstances. You know, if there's special needs family members in the household, how do we manage that when breaking the news? If you're a single parent, how do you parent through cancer? How do you share this with them? As well as if there's concerns about loss and grief. And then they do also have a wealth of additional resources, books, videos, websites, where if you're interested in providing additional support or your kids are asking for more, that you can go to the websites and get that. So just kind of just to show, breaking the news gives you some developmental factors to concern, what to say, what to do, and what to watch for. A lot of times when kids are processing difficult things, we can sometimes see a regression in their behavior. That if they weren't wetting the bed before, maybe they're wetting the bed now, or they're not sleeping well. And those are kind of going back to some soothing behaviors that they knew of previously to help them get through difficult times, and kind of, you know, what to look for, what to watch for. And then if you're noticing these behaviors in your kids, getting them into counseling with a therapist who is trained in working with children is super important. And so this book goes through all the developmental milestones, ages, and I highly recommend it for parents, grandparents, aunts, uncles, whomever is an adult wanting to talk to the child about cancer. Another great book list that I included is off the Yale Cancer Center. They again kind of break it down based off of age, some really amazing books and tools for talking with kids about cancer, or helping them understand what is cancer, how does it work. And then finally, cancercare.org is just a wonderful website. Generally, they offer everything from support groups to education. They have some financial assistance, and really their publications are wonderful. And they have a whole section about talking with children about cancer. They have workshops, publications. You can ask a cancer care specialist. So it is something that a resource that's great in a lot of aspects, especially with their children topic, is really robust. Okay. Another common concern, obviously, is how do we disclose in the workplace? You know, a lot of us have to work either for the money, for insurance, other benefits, and also because sometimes we just like to work. So what should you or should you not disclose to your workplace? So some things to consider is that cancer treatment can lead to side effects, regardless if these are chemotherapy, radiation, immunotherapy, or surgical recovery. There's side effects that can occur, which can lead to you missing work and impact your productivity. And if work doesn't know you're going through a major illness, then this could actually lead to a few cons. You can get disciplined. You could be put on a performance plan. You could be laid off or fired because you're not meeting your goals at work. So it might be a good idea to consider telling work in order to protect your job. Also, in order to access some workplace benefits, and we're going to go through some of those benefits here in a minute, you may have to disclose that you have a medical condition in order to get a medical leave or to request reasonable accommodations. You have to have paperwork filled out by your provider, your physician, stating that you have a medical condition, and oftentimes they want this specific condition, and what kind of accommodations or leave you may need. So it might be something you want to disclose in order to access those benefits as well. And something else to consider is, what is the culture of this workplace? What are your relationships with your coworkers and your bosses? Is this a large workplace corporation, or is it a small family-run business? Do you have trust in your boss and your coworkers? Again, as it is with how do you tell your family, friends, or children, there's no really right or wrong way to go about how do you choose to disclose. We're just kind of reviewing why you may want to choose to disclose and some things to consider. So something to consider is that having a diagnosis of cancer could qualify you to request reasonable accommodations for your job through the Americans with Disability Act. So not every cancer qualifies this. It's a little bit more based on your specific type of cancer or stage of cancer in order to request accommodations. But what do we mean by reasonable accommodations? And this is something that is provided or discussed through the Department of Labor. It's a federal law or standard. And this says that a reasonable accommodation is a change or an adjustment that enables a person with a disability, such as cancer, to apply for a job and or perform job duties by similarly situated employees without disabilities. For example, requesting to work from home. You know, one of, I guess you could say, the benefits of the COVID-19 pandemic has been that there has been much more flexibility in the workplace. Organizations have found ways or been forced to find ways to make working from home successful. So we could certainly put the request in for you to have a working from home schedule. Or maybe a modified work schedule. If we have maybe a harder time getting up and getting the day started in the mornings, you know, can we modify your work schedule for a late start day? Or are there days when you need treatments? Can we modify that work schedule so you have those days off that you need? You could also request additional time to complete projects. A side effect of treatment can sometimes be cognitive issues. Our memory isn't as sharp as it used to be. We maybe have a harder time staying on task or getting goals completed. So it's always worth asking, is this a project that you can get some additional time on to complete? Different office equipment. You know, do you have a job where it's required for you to stand, like being a cashier or a greeter at a store? That might be too hard on your body depending on what treatments you're on. Is there a chair we can get you? Is there some other kind of equipment that can be provided so you can still do the functions of your job successfully? Or And finally, another example is additional leave of absences. Do you need some more time off? Have we exhausted maybe some of the other medical leaves, which we're going to talk about, or our paid time off or sick leave bank? And do we need to take a leave of absence? That could be covered under the Americans with Disability Act. Now, just because you put a request in for reasonable accommodations, it doesn't mean that you're guaranteed to get that. All requests have to be approved by the employer, and if they are going to cause undue hardship for the company, they could get denied. And depending on the company, they may have paperwork or forms that need to be filled out by your oncologist regarding the accommodations, or they may request a letter from the oncologist stating what your what kind of accommodations you need and for how long you may need them for and why, what's going on for you to need them. So when we're talking about medical leave, there are a few things that kind of get bundled into that conversation. The first is called family medical leave. You may also hear it as the term FMLA, and this entitles eligible employees of covered employers to take unpaid job protected leave for family medical reasons with continued health coverage. So this just gives you time off unpaid for you to handle your medical situation and keep your insurance in your job. So that when the condition resolves or when you're feeling well enough to go back to work, your job is waiting there for you and you've been able to maintain insurance throughout this time off. Now, some of the key terms here are what are eligible employees and what are covered employers. So covered employers are private employers with 50 or more employees, or any public agency, regardless of the numbers of employees. So it kind of depends on, do you work for a private employer versus a public employer? If it's a private employer, how many people work there? They may not be mandated to provide FMLA if it is a smaller private employer. However, they may still offer some kind of family medical leave. So it's always good to talk if there's a human resource person or to a supervisor or boss. And what are eligible employees? And that is someone who's worked for the employer, the covered employer that has worked there for at least 12 months, or has worked at least 1,250 hours in the last 12 months and works at a location where the employer has at least 50 employees within 75 miles. So you pretty much have to be working someplace for a year in order to be able to access this leave. And again, family medical leave is mandated through the Department of Labor with the federal government. If you do have a smaller employer, as I said earlier, it's always worth talking to your boss, or if they do have a human resources person, to see if they offer any kind of alternative leave. Traditionally, family medical leave is 12 weeks of leave. A lot of folks may be more familiar with this as for like a maternity leave. These 12 weeks can be used continuously, meaning you get that 12 weeks off in a block of time, or it can be used intermittently, where you take the time off that you need. If you know you're having treatment on a Tuesday and you know that Thursday, Friday, you're not feeling not so hot days, maybe you take Tuesday, Thursday, Friday off that week. And so you're pulling from that FMLA bank. Something else to consider is if your workplace offers any kind of disability benefits. And not every workplace offers these, and some of these are not just automatic. You may have to choose to enroll in these benefits during your open enrollment with your employer. But for short-term disability, each policy is based on the employer benefit package, but it pays you something. It pays you usually 60 to 80% of your salary, and this can be used concurrently with FMLA. So FMLA may help protect your job and your insurance, and short-term disability can give you some pay. And there's usually a length of time as to how long you can utilize short-term disability benefits, and this really does vary based on your employer. Also, with long-term disability is based on your employer as well, and it pays a little bit less, 50 to 60% of your salary. And this is usually for people that maybe have exhausted FMLA, have exhausted short-term disability, and are still just not well enough to return to work. And so we kind of really need to focus just on your health and your wellness, and maybe not focus so much on going back to work. Being sick can be a full-time job, and so we really need to make sure that you're taking care of yourself. Something to note is a lot of these long-term disability policies do require that you also apply for Social Security benefits. And again, if you have any questions about what your workplace offers, it's definitely beneficial to talk to an HR department. Not every workplace has that, so whoever in the higher up hierarchy that you need to talk to, I would strongly encourage that. So again, here are some really amazing resources regarding choosing to disclose in your workplace. So Cancer and Careers, again, is one of my top favorites. And what they do here is they have a lot of publications, as well as some really well-trained individuals that can help you figure out what are your legal and financial rights, and give you tips for getting back to work after cancer, as well as kind of some tips and tools on how to work with your manager or your boss. So I think that they have some really great resources to peruse and look through if you have questions about what are your rights as a worker. And they also have Ask a Career Coach. So if you feel like you're a little stuck or you're not sure, you could certainly put in a request to ask your career coach, and they should hopefully be able to answer those specific concerns. Another website that I use a lot is called Triage Cancer. And so what I really like about them are their materials. And so they have what we call these quick guides. So really they have all of these guides about, I'm sorry, some of the photos aren't pulling up here, like quick guide to disability insurance, to Social Security, to navigating long-term disability insurance. So they have just some really good handouts that you can download and print out for free with a variety of topics, and really try to break it down in a way that's easy to understand. So Triage Cancer, if you're still unsure of what your rights are or how to navigate this process, is another wonderful resource. Now, what if we feel like that our rights as a worker, we're being discriminated against because we have cancer, that you are not getting your benefits, that you are feeling like the work that you're doing, or that you're being penalized for taking your benefits? That's where the Cancer Legal Resource Center could really come in. And the Cancer Legal Resource Center is a nonprofit, and they work with lawyers where if you have legal questions, if you have a case, or if you have concerns if your legal rights are being infringed on because of your cancer diagnosis, that they can try to help navigate next steps for you. I think they do give some legal advice, or they can help connect you to other attorneys in your state that might be able to help further. So that's just kind of great if you do feel like things are getting a little bit tricky at work. This is kind of backtracking a little bit, but when I talked about job accommodations, the JAN network, the Job Accommodation Network, has some really great ideas of what kind of accommodations folks have requested. Let's see if I can find cancer here really quick. So it gives you an idea about cancer with the American with Disability, accommodating employees with cancer, publications. And so they have a lot of really great ideas as to how can we word these requests, and what some ideas of what to request. So let's say you have decreased stamina or fatigue from treatment. They may say, hey, maybe some stools, maybe a walker or other ergonomic equipment to help with stamina, maybe flexible schedules, periodic rest breaks, teleworking. So they kind of give you some ideas as to what are things that you could request, and how to utilize the verbiage to make that request. Emotional changes. So No one expects to get diagnosed with cancer. That is a life-changing thing that is really difficult. And it's not to be sugar-coated, but it is life-changing. And it can cause psychological and emotional distress. So we do see a lot of patients, especially following a diagnosis, having these increased feelings of depression and anxiety. There's estimates that 15 to 25% of people diagnosed with cancer also suffer from depression, and estimates of up to 20% of people diagnosed with cancer also suffer from anxiety. And sometimes it's not just the cancer patient that is struggling psychologically and emotionally. It can also be our caregivers. Seeing your loved one going through this life-changing illness is really devastating as well for our caregivers. And they may need some additional support and love because they also experience anxiety and depression. Traditionally speaking, anxiety and depression are at their highest peak following the diagnosis. You're still getting information. Things are overwhelming. We're not sure what our next steps are. Do we need more tests? Do we need additional biopsies? Maybe we need some blood work. Are we going to do, what is our treatment that we're going to do? So all of those unknowns factor into these peaks following a diagnosis. However, it is noted that once a little bit of time has passed and patients and caregivers get a little adjusted to the ebbs and flows of having a cancer diagnosis, these feelings tend to level out. Sometimes it's the anticipation of treatment that is worse than the actual treatment itself. And once you know how you're going to feel on treatment or what your treatment plan is, we do tend to see that anxiety and depression kind of start to decline and then eventually go back to baseline. So for a review, what is depression? Depression causes feelings of sadness and or loss of interest in activities that you once enjoyed. Maybe you were an avid knitter or an avid exercise person, and now you have no interest in doing those things. That's a symptom of depression. It can also be unexplained tiredness. You just feel all the time and you don't know why. Feeling worthless, decreased concentration, and or thoughts of death or suicide. So those are some of the emotional feelings that are associated with depression, but there could be also some physiological or physical symptoms of depression. Unintended weight loss or gain, not due to treatment. So maybe we're feeling really sad and we just have no appetite. That causes weight loss. Or maybe we're eating our feelings, as they like to say, where we feel like, we're just really sad. And so we're going to eat some comfort food to make ourselves feel better. And we, put on some weight because of that. Having problems sleeping, like you're sleeping all the time, or you're not sleeping at all, but you're just kind of laying in bed lethargically. Changes in your energy level and fatigue that's not due to treatment. Now, depression is different from normal sadness. People can be sad, but not depressed. So when do we get concerned for depression? And that's been these symptoms I just mentioned last for more than 2 weeks and interfere with your ability to care for yourself. You're not showering enough. You're not getting dressed or staying in pajamas all day. Although that is a little hard with COVID. But things that are impacting your ability to get out of the house or even out of bed sometimes. Included on here, there's from the Mental Health Association, the national organization, I include a screening tool. So if anyone is interested to see, this kind of hits home a little bit. Am I depressed? There's a self-screening tool that you can do to kind of indicate, based off the testing, what they say about your level of depression. And next steps to take because of that. What is anxiety? Anxiety can be a normal reaction to stress, and sometimes it can be beneficial. However, anxiety can become a concern when these normal kind of nervous feelings impact our daily living and involve excessive fear or anxiety. Like that feeling in the pit of your stomach is sometimes a good reaction to stress, like in a normal thing, like excitement or nerves because you're getting married or because you're having a baby, some of the things that are normal stress reactions, versus anxiety, which is we're so nervous about something we can't leave the house. Because if we leave the house, something bad is going to happen. It's unease, fear, and dread that is caused by anxiety. And it can also have some of those physiological symptoms, such as a fast heartbeat, nausea, feeling a little shaky, having that tight feeling in your throat or chest, and having a hard time concentrating because your mind is going to all the different places that you're having a hard time focusing on one thing. And again, I've included, if you feel like this is kind of hitting a little bit close to home, there's a screening tool here for anxiety, again, through the National Mental Health Association, that might be beneficial to take and kind of see what level you're at and what are some suggestions. So what do we talk about for treatment for depression and anxiety? One of the main ways to treat depression and anxiety is through medications. Antidepressants can help relieve depression and its symptoms. It impacts the chemicals in your brain, the neurotransmitters, because sometimes depression can impact that and they're not firing on the synapses the way that they should, but it can take a few weeks before it becomes effective. So that's something to consider, is that for treatment of depression, it's not a quick fix. Sometimes it might take a little while before you notice a change, at least with medication. With anti-anxiety medicine, it doesn't actually cure or relieve the anxiety, but it helps provide relief of the symptoms you experience from anxiety. So it might help take that edge off of those anxiety feelings, so you're able then to get to the why are we feeling anxious and what can I do to work through this anxiety so it doesn't always happen. If you're interested in medications, I strongly recommend discussing with your medical team, your oncologist, or your primary care. They may suggest that you see a psychiatrist for management of this, but it's a good place to start with your primary or your oncologist. Something that can really be a great complement to medications is counseling, and this is talk therapy. And what they can do is help you identify these negative thought processes that are leading to these depressive or anxious episodes, be able to identify when they're occurring, and help you develop internal coping skills to utilize so that you can be like, hey, this is how I am feeling when I know I'm getting depressed or anxious. How can we try to stop this negative pattern from happening? What are some of my tools in my toolbox I can use to minimize this? I love putting the medications and counseling together. Some people just want medicine. Some people just want counseling. That's okay too. It really, again, depends on what feels right for you. And counseling can occur on a one-on-one sessions, either in person or over telehealth, or in a group setting like a support group. One of the biggest concerns or emotional changes that can happen related directly to cancer treatment is hair loss. And hair loss is one of the most distressing side effects for both men and women. So it's really important that you ask questions from your physician or your nurse practitioner as what to expect. You know, certain chemos can result in hair loss, but it can also result on other hair loss on parts of your body, such as your eyebrows, your armpits, your legs. So just kind of being aware of where hair loss is going to occur. And also realize not all chemotherapies or treatments can cause hair loss. So really talking to your provider about, is this a chemo or treatment that's going to cause this or not, just so you know what to expect. Sometimes it may not cause complete hair loss, but maybe some hair thinning. And just know if hair loss is expected to happen with your chemotherapy, it usually doesn't happen all at once. It does occur more over time with the more treatment you receive. Traditionally, we see some thinning after the first round of chemo, and then with more hair loss happening after the second. Something that might make you feel not better about it, but at least have more control, is to be proactive. If you are going to be on a treatment that is going to cause hair loss, you know, maybe we decide we're going to have a cute little short haircut before that happens. We take control of it, you know, so then it's also a little bit less distressing when we do lose hair, that it's not little long pieces of hair that are coming out. Or some individuals decide that I'm going to shave my head before treatment. We know what's going to happen. I'd rather it be on my own terms versus waiting for it to happen. You could also try to get fitted for a wig prior to hair loss occurs so that when hair loss does happen, you already have a beautiful wig that you want to wear that feels like it fits you. And I know LivingWell has some great wigs available for patients. And it's always great to get support. There's a lot of organizations out there that offer peer support. We can talk through with other patients who have finished their chemotherapy or finished their treatments and gone through a hair loss and get ideas of how do they cope with this. And it helps validate your feelings. So as I mentioned, there's some really great resources. Many cancer centers themselves have mental health professionals that can assist in managing these complicated emotions. So you may need a referral from your medical provider in order to get connected with one of them. And then when we're talking about the Chicagoland area, we have a wealth of what we call cancer support centers or cancer resource center. Obviously, we have LivingWell, who I'm talking with today, but there's also the Wellness House, Gilda's Club, the Cancer Support Center, and then Waterford Place. And I listed all of those locations as well as the websites for you to peruse at your own time. They offer very similar services such as counseling, support groups, yoga, exercise, nutrition programming. So they all have some really amazing ways to kind of help coping with cancer. And one of the biggest things that patients have are financial and insurance concerns, because life and bills don't stop when you get cancer. So how do we manage to navigate financially and with health insurance, how we're going to get through cancer and cancer treatment? So Social Security disability are disability benefits that are offered through the federal government. In order to qualify for them, you have to meet certain criteria. You need to have enough work credits. And what work credits are you need 40 work credits with 20 in the last 10 years. They broke down what does work credits mean. And if you have questions about work credits, I'll show you kind of where you can create a Social Security account and see if you qualify work-wise for these benefits. You also have to not be gainfully employed, meaning that you're not able to work because of your condition. And this condition is expected to last at least a year. And by not gainfully employed, we mean that you earn less than $13.10 a month. If you make more than $13.10 a month, then you are not considered disabled right off the bat. You'll be denied. Now, the $13.10 a month is income. It is not disability benefits you may be getting through work. Okay, so it's purely income wage. And you obviously have to have a medical condition to qualify. And each cancer type has different qualifying criteria. Okay, something to consider is that Social Security disability is income only and does not include any kind of health insurance. And how much income you are expecting to get depends on how much you paid into the system over the years via taxes. And it's not something that begins right away. There is a 5-month wait for these benefits to start. So if you're approved for benefits in January, they're not going to start paying until June. And this is just something of how the system works. There's not a great rhyme or reason to it, to my knowledge. So if you have questions on, is your cancer condition considered disabling, there's this, and I included this link on the slide. It's called we call it the Blue Book, but I pulled up the disability evaluation under Social Security for adults. And so they have all the different cancers here listed on the left. And if you click on your disease site, it'll tell you that you qualify if you meet 1 or 2 or this or that or this. So there's a lot of different variants as to what would qualify you based on your cancer type. Usually it's based on how advanced is your cancer, has your cancer come back, and the cell type of your cancer. If you have questions about this, typically you may have a social worker at your cancer center that can help navigate this process, or maybe someone in patient financial services, depending on your institution. Or you could always reach out to your local Social Security website, Social Security office. The Social Security offices, I think they're still pretty remote for the most part, but I think they are doing some appointments if you schedule them. So you can certainly try to make an appointment at your local office, or you can call the 800 number. I would recommend calling early in the mornings because you're going to be on hold for a little bit. And they can kind of answer some questions for you. If you're curious as to how much money you may get from Social Security, or if you have enough, if you qualify for the benefits based on your work history, if you go to the ssa.gov website, again, this is included in my slide deck, and you click on sign in, sign up, and you go to My Social Security, you can create an account that will show you all this information. And I do recommend, if you're going to apply for disability, I would do it electronically, and you do it through your Social Security account, okay? Because that is going to allow you to track the status of your application, and you can get notifications in your Social Security account about where you're at with things. So it's the best way to track what is happening with your application for disability benefits. Okay, but there we go, next slide. But what if you don't have the work history? You know, what if you don't qualify for the Social Security disability benefit for whatever reason? Then you might, depending on your financial situation, you could possibly get the supplemental security income, which is SSI. And this provides incomes for adults who are disabled and meet financial limits. And this could be, as I said, an alternative for those who do not have the work credits to apply for SSDI. You still need to medically qualify, so it's the same criteria. And then you need to have earned less than $814 a month for an individual or $1211 a month for a couple in order to qualify for this type of program, as well as have assets under their limits of $2,000 in the bank individually or $3,000 for a couple. Now, I know that there are some folks who maybe were homemakers or caring for their children. And so that doesn't mean you're not able to get disability benefits. If you've been married greater than 10 years, there's the potential that you could get disability benefits through your spouse. And that's something to talk to Social Security directly about. If you think you have, if you think you qualify for SSI, you should contact Social Security directly so you can do an application over the phone with them. That is the best way to do it, or to go into your local office if they are accepting walk-ins, or to make an appointment. Now, what if the scenario happens where you lose your employer-based health insurance? Either because you're not able to return to work or for some other reason. What are some alternatives that you can have? One is COBRA. If you lose your job, then either because you're not able to return and you're staying on disability, or you have to leave for another reason, then COBRA is something that will be offered to you. And it allows you to keep your workplace health insurance, but you have to pay a higher monthly premium for this. Typically with these workplace insurance policies, the workplace subsidizes the monthly premium, so you're paying a portion of that out of your paycheck to have the benefit. So this takes away that subsidy. So sometimes you can pay quite a bit for these policies. Usually we've seen prices $800 up to $1,500 a month. So would you ever decide to take COBRA? It depends. If you've met your out-of-pocket maximum for the year, meaning you've reached that benchmark with your health insurance, and they're going to cover you at 100% for the rest of the year for services, then you may want to consider it versus starting over with a new health insurance. Kind of also depending where in the year you are with things too. If you're kind of closer to the end of the year, that might make sense, versus right now in February, that's may not make as much sense because it could be more dollar, it's a longer time to pay that higher premium. So what are some alternative insurance options to COBRA? First one to talk about is Medicaid. That has the state public insurance, and it has income guidelines that need to be met in order to qualify, and it varies state by state. In Illinois, there's a little bit more leniency in the state Medicaid program compared to other states. where they have programs for Medicaid if you are a patient with breast or cervical cancer that you can get Medicaid through, as well as programs for families and programs for adults. So it's definitely worth checking with the Department of Family Services to see if you qualify for Medicaid. Again, it also might be worth talking to your cancer center to see if they have anyone that can either answer questions about Medicaid or help you with that process. I know at least with Northwestern that was something that was in place with some community agencies. If you make too much money for Medicaid, then you may be affordable for a plan through the Affordable Care Act, which became law under President Obama. And this is like a health insurance marketplace where you can purchase plans and be guaranteed a policy. And they still go based off of income, where if you do have a lower income, not low enough to qualify for Medicaid, but a lower income, you could get a tax subsidy to help lower these monthly costs. And so these policies kind of vary. You would enroll in it for the year, and you want to take a look every year at the marketplace to make changes as needed. And I also would work with your cancer center as to what insurances they take off the marketplace, because they probably don't take all of them. And then finally, Medicare. If you are over the age of 65, you will have the option to enroll in Medicare. That is the Medicare enrollment age. Or if you've been receiving 2 years of Social Security disability benefits, the SSDI, then you can have early enrollment into Medicare regardless of your age. So those are all options for alternative insurances. Kind of going back to my slides here. So here's the healthcare.gov website. This is the marketplace, also known as the Affordable Care Act, also known as Obamacare, has a lot of different names. And then from here, you could kind of see if you can enroll or get coverage and what kind of subsidy you would qualify for. And then the Medicare.gov website is great for those who are eligible for Medicare, either because of their age or being on disability for 2 years, where you can find plans, you can get some questions answered about your Medicare questions, because Medicare is not always the easiest system to navigate. If you are eligible for Medicare and you are having a hard time navigating Medicare and what plans to enroll in, what are our options, then Illinois has the Senior Health Insurance Program, also known as SHIP, which is free statewide health insurance counseling for Medicare beneficiaries. So I would definitely contact SHIP or your local senior services agency to talk to a SHIP counselor to kind of help get those questions answered. And when we're talking about Medicaid, that's through the Illinois Department of Human Services, IDHS. And so, as I said, I would contact your cancer center to see if they have any assistance available in applying for any Medicaid programs. If not, maybe sometimes the local health department would have resources for you, and can kind of see if they can help you qualify for anything. But again, with Medicaid, you have to meet certain income guidelines and sometimes asset guidelines too. It's a bit of a nuanced system. So these are the resources I just talked about. Triage Cancer is one I talked about earlier. They also have some really great web brochures and educational materials on Medicare, on health insurance, on things like that.